Hello friends, welcome all of you. Today in this video, we'll learn about the nursing care plan on postpartum hemorrhage या postpartum hemorrhage या PPS. This is very important nursing care plan. We prepared here with very easy way, so you learn easily this care plan. इससे पहले हम हमारे प्रीवियस वीडियो में एंटीपार्टम हेमरेज का नर्सिंग केयर प्लान आपको बता चुके हैं। तो ये दोनों ही केयर प्लान बहुत इम्पोर्टेंट है, तो आप इनको यहाँ हमारे चैनल के थ्रू लर्न कर सकते हो। तो आइए देखते हैं नर्सिंग केयर प्लान ऑन पोस्टपार्टम हेमरेज या पीपीएच। एज अवर टॉपिक नर्सिंग केयर प्लान ऑन postpartum hemorrhage या postpartum hemorrhage, that is in short PPH. First, we learn here postpartum hemorrhage introduction shortly. Here, postpartum hemorrhage is usually defined as the loss of more than 500 ml of blood during or after delivery. This is postpartum hemorrhage. Means postpartum hemorrhage में जो blood है वो 500 ml से अधिक निकलता है during the delivery and after the delivery. This is postpartum hemorrhage when bleeding is more than 500 ml after delivery or childbirth. Hemorrhage may occur early within the first 24 hours after delivery or late up to 28 days postpartum. Hemorrhage जो जन्म के 24 घंटे के अंदर हो सकते हैं या फिर ये 28 डे पोस्टपार्टम तक कभी भी हो सकता है. दिस इज पोस्टपार्टम हेमरेज ब्लीडिंग. नेक्स्ट देखते हैं क्लाइंट असेसमेंट डाटाबेस. मीन्स for nursing care plan we assess the client about some specific features. By this we decide this is postpartum bleeding or hemorrhage. First is here may report excessive fatigue and blood loss at delivery, generally may be 400 to 500 ml. Vaginal delivery and 600 to 800 ml for cesarean section. This is specific for PPH. यदि नॉर्मल डिलीवरी है तो ब्लड 500 ml से अधिक है तो इसको हम पोस्टपार्टम हेमरेज में कंसिडर करते हैं. और यदि सीजरियन डिलीवरी है और इसमें ब्लीडिंग 600 से 800 ml या 1000 ml तक हम कंसिडर करते हैं पोस्टपार्टम हेमरेज में. नेक्स्ट क्लिनिकल असेसमेंट डाटाबेस हियर. क्रोनिक एनीमिया मे बी एनजीएस, fearful and apprehensive. This is client and here previous postpartum hemorrhage also assessment here. Next changes in BP pulse. Next may have excessive vaginal bleeding here. Next oozing from the cesarean incision, episiotomy, symptom of shock, severe alveolar vaginal pelvic and back pain with hematoma formation. These are the clinical database. These are the basis for nursing care plan. Next देखते हैं nursing priorities during care plan here. Maintain or restore circulating volume, tissue perfusion and prevent complication. These are the nursing priorities during nursing care plan. For postpartum hemorrhage nursing care plan, PPH nursing care plan, by assessment we plan here. First nursing diagnosis, that is deficient fluid volume related to excessive blood loss after birth. This is our first nursing diagnosis. आप यहाँ पर पिक्चर में देख सकते हैं. हम इसको डिटेल में आपको बताते हैं. दिस nursing care plan we use where nursing process step. Here our first nursing step is nursing assessment. On this assessment basis we plan here nursing diagnosis. तो आइए देखते हैं nursing assessment here. First history of labor amount, type and site of bleeding, location of the uterus and degree of uterine contractility. Next, presence of valvular hematoma. Next, BP, pulse, mucous membrane assessment. Next, assessment of the mental status. On the basis of these assessment, we plan a nursing diagnosis for this client. Here, our nursing diagnosis is deficient fluid volume related to excessive blood loss after birth. This is our nursing diagnosis. For this diagnosis, we plan our expected outcome and goal for the patient. Here, our expected outcome is client will maintain fluid balance and stabilization. Means client का fluid volume है वो maintain और stabilize हो. This is our expected outcome. We gain or reach this outcome by the following interventions. Here, interventions or rationale for this nursing diagnosis. Here, intervention and rationale. First intervention is here, assess and record the color, amount and type and site bleeding. Here, rationale is to estimate blood loss. Next, second intervention, noting causative factor to bleeding. Here, aid in establishing appropriate plan of care. Next, to monitor vital sign every 15 minutes for first hour and then every 4 hour for 24 hours. Here, rationale is to detect sign and hemorrhage and shock. Next diagnosis here, next intervention here, massage bogy uterus here with one hand while placing second hand just above the symphysis pubis. Here, rationale is may decrease blood loss. Placing one hand above symphysis pubis prevent possible uterine inversion. Next intervention for this, measure intake and output and urine specific gravity as indicated here. Rationale is useful in estimating fluid loss. Next intervention, avoid performing vaginal and rectal examination. Here, rationale is may increase hemorrhage. Next intervention, administer IV fluids, blood and blood products. Here, rationale is for this intervention, increase circulating volume and enhance clotting. And last intervention for this, administer medication that is oxytocin, heparin, antibiotic. Here, rationale increase contractility by the use of oxytocin, and heparin may be used cautiously to stop the clotting cycle in DIC, and antibiotic used to prevent infection. These are the interventions for this nursing diagnosis. Here, deficient fluid volume related to excessive blood loss after birth. After providing these interventions systematically, which monitor and evaluate the client for our goal achievement. Here, this is evaluation for this client. Means after providing these interventions, we find a revelation that the clients demonstrate improvement in the fluid balance and stabilization. Here, this is our first diagnosis complete through this evaluation. Next, देखते हैं diagnosis second for nursing care plan PPH. Here, our second nursing diagnosis, ineffective tissue perfusion related to hypovolemia. This is our second nursing diagnosis for nursing care plan on PPH. तो आइए देखते हैं nursing assessment here for this diagnosis. Here, nursing assessment is vital sign hypovolemia, level of consciousness, status of peripheral circulation such as color of nail, gum, tongue, result of lab tests such as hemoglobin, hematocrit, ABGs and pH level. These are the nursing assessment. On the basis of These assessment be plan a nursing diagnosis that is ineffective tissue perfusion related to hypovolemia. Here our goal is or expected outcome is to maintain effective tissue perfusion. Next देखते हैं for this diagnosis intervention and rational. Our intervention first monitor vital sign to monitor client status rational. This is next nursing intervention monitor hemoglobin and hematocrit to determine severity of blood loss. Next note level of consciousness. Changes in sensorium are early indication of hypoxia. Next, observe peripheral circulating status such as nail, gums, mucous membrane, etc. to rational layer to know the circulating status and cyanosis condition. Next, monitor ABG, pH level, air. Rationalize help in the diagnosing degree of tissue hypoxia or acidosis. Next, provide supplemental oxygen as needed. Rationalize maximizes available oxygen for the circulatory transport to tissue. Next, intervention insert airway suction as indicated. Air rationalize facilitate oxygen administration in presence of retained secretions. तो ये था nursing interventions for this nursing diagnosis. After providing these interventions here, find the evaluation that the effective tissue perfusion maintained and client display vital sign ABG, hematocrit, hemoglobin within normal means जो हमारा गोल था हमने अचीव कर लिया बाई दीज इंटरवेंशंस. तो ये था सेकंड नर्सिंग डायग्नोसिस. नेक्स्ट देखते हैं नर्सिंग डायग्नोसिस नंबर थर्ड फॉर नर्सिंग केयर प्लान ऑन PPH. Here this is nursing diagnosis number third. Risk for infection related to traumatized tissue. This is nursing diagnosis. तो देखते हैं फर्स्ट नर्सिंग असेसमेंट स्टेप फॉर दिस डायग्नोसिस. वी प्लान एयर नर्सिंग असेसमेंट एयर vital sign assessment sign of the infection at wound site episiotomy cesarean section. Next symptom of infection such as malaise chills anorexia and uterine tenderness. These are the nursing assessment. Here you can see here easily this nursing assessment. On the basis of nursing assessment we plan here the nursing diagnosis, and this is rest for here this is risk for infection related to traumatized tissue. This is our nursing diagnosis. Here expected outcome here client will display vital sign within normal range and infection subside here. This is our goal. Here our intervention and rationale for this diagnosis. First is demonstrate proper hand washing and self care technique. Rationale is to prevent infection. Next, monitor vital sign. Rationale is to detect infection. Next, third, observe wound site here to check localized infection process. Next, note symptoms of malaise, chills, uterine tenderness, and pelvis pain. Rationalize these symptoms indicate systematic involvement of the infection bacterium. Next intervention here investigate other potential source of infection such as mastitis, respiratory, UTI. Here rationalize correct diagnosis is critical for effective treatment. Next here intervention is review WBC count. Here rationalize leukocytosis signifies infection. Next rationalize intervention is obtain gram sustaining and bacterial culture. A rationalize identifies type of infection. Next, administer antibiotics as prescribed to treat infection. These are the interventions for this nursing diagnosis. Next, देखते हैं evaluation here. Here evaluation is infection subside and vital sign and lab value within normal limit. So after providing these interventions, we find or reach our goal सक्सेसफुली. तो ये था नर्सिंग डायग्नोसिस नंबर 3, रिस्क फॉर इन्फेक्शन रिलेटेड ट्रोमेटाइड टिश्यू. Here next diagnosis is anxiety related to situational crisis. Here नर्सिंग असेसमेंट देखते हैं हम. Physiologic response to PPH such as tachycardia, tachypnea, restlessness and irritability. Here next psychological response to PPS. Next on assessment, defining sign are increased tension, fear, helplessness, restlessness, anxious. These are the nursing assessment. On the basis of these assessment, here we plan nursing diagnosis for this patient. Here anxiety related to situational crisis, that is postpartum hemorrhage. यहाँ हमारा एक्सपेक्टेड आउटकम गोल होगा टू रिड्यूस एंजाइटी. To achieve our goal, we do different interventions for this client here. Here intervention and rational. First intervention here, evaluate client's physiological and psychological response to PPH. Here rational is add in formulation of plan of care. Next convey calm, empathic, supportive attitude. Here rational is to reduce tension and anxiety. Next provide information about the treatment modalities and effectiveness of the intervention. Here rational is accurate information can reduce anxiety and fear of the unknown. Next intervention here, encourage client to verbalize feeling. Here rational is verbalization provide an opportunity to clarify information and correct misconception. Next intervention here, refer client couple to appropriate source for counseling as indicated here. Rational is helps reduce anxiety through counseling process. So these are the interventions and the rational. आप यहाँ पर कंप्लीट नर्सिंग केयर प्लान देख सकते हैं. After providing these interventions here, we find the evaluation for this client. Here our evaluation is anxiety reduced and client appear relaxed. Here anxiety reduced and client appear relaxed. नेक्स्ट देखते हैं नर्सिंग डायग्नोसिस. हमारा नेक्स्ट डायग्नोसिस है acute pain related to tissue damage, accumulation of the blood underneath the skin of the perineum. इसके लिए हमारे असेसमेंट यहाँ पर होंगे. एयर nursing assessment, assess psychological cause of pain and discomfort, identify pains types, location, duration and severity. Next assessment for extent of perineal laceration. Next inspect perineal area for the presence of hematoma. These are the nursing assessment. On the basis of these assessment, we find or plan here nursing diagnosis, that is acute pain related to tissue damage, accumulation of the blood underneath the skin of the perineum. Here expect goal and expected outcome to relieve from pain and discomfort. Here for this diagnosis, we do certain interventions for the client. Here intervention and the rational. First intervention here encourage relaxation technique and diversional activities. Rational होगा. These distract the client from the presence of pain. Next applying an ice pack into perineum. Cold application can limit small hematoma. Next promote using hot sitz bath or heat lamp to episiotomy extension. Here rational is to reduce pain and enhance wound healing. Next encourage the client to eat high fiber food and increase fluid intake. Here rational is to avoid constipation and pneumonia. Next, administer analgesics as prescribed for relief of pain. This is rational for analgesic. Next, administer laxatives. Here, rational is to prevent postpartum constipation. And last intervention here, assist in the repair of perineal laceration, facilitate healing process. These are the intervention for this nursing diagnosis, and after providing these interventions, we find there the evaluation. The last step of nursing process, the client relieved from pain and now feel comfort. We achieve our goal successfully. This is here nursing diagnosis. Acute pain related tissue damage, accumulation of blood underneath the skin and the perineum. तो फ्रेंड्स यहाँ से आप नोट्स ले सकते हो इजीली. दिस इज़ वेरी इंपॉर्टेंट नर्सिंग केयर प्लान. दिस इज़ फर्स्ट nursing care plan diagnosis. Next, second nursing care plan diagnosis. Here third nursing care plan diagnosis. Here fourth nursing care plan diagnosis, and this is last nursing care plan diagnosis for postpartum hemorrhage. तो फ्रेंड्स, आप यहाँ पिक्चर से इजीली सारे नर्सिंग केयर प्लान को नोट कर सकते हो. एक बार फिर हम देखते हैं. तो ये थे हमारे डिफरेंट नर्सिंग केयर प्लान डायग्नोसिस फॉर पोस्टपार्टम हेमरेज. तो फ्रेंड्स, आज हमने वीडियो में नर्सिंग केयर प्लान ऑन पोस्टपार्टम हेमरेज या पीपीएच या पोस्टपार्टम हेमरेज को लर्न किया. दिस इज़ वेरी वेरी इंपॉर्टेंट नर्सिंग केयर प्लान. तो आपको वीडियो कैसा लगा तो अपने लाइक्स कमेंट जरूर भेजिएगा, एंड शेयर दिस nursing care plan video with our friends, and subscribe my YouTube channel Anand Nursing File and press bell icon also. Thank you.